Hello and welcome to Wellness Central, where wellness is essential. Today we're going to discuss a topic that affects millions in the Western world and across the globe, the global scourge of prediabetes, insulin resistance, and diabetes. These conditions are a multifactorial problem, usually manifesting after years of poor dietary choices, lack of exercise, excess stress, and high dietary sugar intake. The body loses its ability to process excess sugar in the blood as well as properly regulate insulin secretion. Insulin, the sugar-shuttling hormone, is responsible for keeping blood sugar levels balanced and your body in a healthy state. Consuming foods like partially hydrogenated oils, canola oil, soybean oil, corn oil, and the likes, ingesting high sugary processed foods and drinks, as well as consuming foods without nutrient density, can lead to prediabetes, diabetes. Furthermore, excessive carbohydrate intake can lead to excessive sugar in the blood, and thus the corresponding increase in insulin. Also, severe stress triggers the release of cortisol, a stress hormone linked with the release of blood sugars. Couple this with the standard American diet, filled with fatty, processed, and packaged foods, and we have a recipe for disaster. In tandem with insufficient exercise, most people today don't realize that their dietary habits and choices are fueling a metabolic condition characterized by high blood sugar levels, oxidative stress, inflammation, and high cortisol. All factors contributing to diabetes and ill health. Today, we're going to delve into the 7 skin signs that your body may be experiencing diabetes, prediabetes, or insulin resistance. The skin, the body's largest and most transparent organ, will develop subtle signs and indicators warning you that it's time to take a step back and evaluate your health from a different perspective. We here at Wellness Central are here to guide you in this process back to health and wellness. Pull up a seat and take notes, because at the end, we'll be revealing some tips on how to reverse insulin resistance and high blood sugars and restore your health to homeostasis and happiness. Don't forget to like this video and subscribe for more life-saving tips. Let's get started. 1. Skin tags. People may develop multiple tiny growths or skin tags in various areas, including the groin, neck, and upper extremities. While a few skin tags are normal, a notable increase in their occurrence may indicate an underlying problem such as prediabetes or high blood sugar. High blood insulin levels have the ability to weaken your immune system and reactivate the HPV virus, which can cause new skin tags and occasionally warts. Notably, individuals who effectively address insulin resistance frequently experience a spontaneous decrease and elimination of these skin tags. 2. Coming in at number 2 are fungal toenail infections. People with high blood sugar or prediabetes are more likely to develop fungal infections in their toenails, which can cause thicker, discolored, and yellowed nails. Athletes' foot infections are characterized by intense itching and cracking of the skin around the toes and feet. It's important to realize that fungi love sugar, and so the more sugar in your blood, the more conducive the environment is for fungi to develop on your feet. Furthermore, the immune system is weakened by diabetes and prediabetes, leaving your skin more vulnerable to fungus infections. These infections can include chronic yeast infections and ringworm. Make sure you set an appointment with your dermatologist to properly and accurately diagnose these conditions. 3. Darkened discoloration of the skin. These patches are most commonly found in the folds and creases of your body, like the armpits, back of the neck, or the groin. The underlying cause of these patches is the overabundance of sugar and insulin in your bloodstream, which causes an accelerated proliferation of skin cells. These newly formed cells have a higher concentration of melanin pigment, which makes them appear visibly darker than the surrounding skin. In addition, these patches may have a dry texture, and some people may also develop several tiny growths or skin tags. 4. Coming in at number 4 is tingling or burning sensations in the feet. Although it may not be visible, you may feel tingling in your feet, which is the next symptom to be mindful of. Feelings like deep tingling, burning, itching, stabbing, or even electric-like pain in your toes or feet are caused by damage to the nerves in your feet from diabetes or persistently high blood sugar, which erodes the nerve's protective outer layer and causes them to short-circuit, much like a broken electrical wire. 5. The existence of tough skin on the fingertips is our 5th clue. When diabetes is not properly controlled with dietary changes, it can cause a noticeable thickness and waxy appearance on the knuckles, fingers, and hands. This is especially common in situations of insulin resistance and can cause greater stiffness in the hands and the feeling of having stones between your fingers. Ensure that you have this condition properly diagnosed and assessed, considering that it can resemble many things, from Raynaud's phenomenon to arthritis. 6. Shin spots. Elevated blood sugar levels and diabetes can damage the blood vessels beneath the skin, causing blood byproducts to leak into the skin. This can lead to the development of dark brown, reddish-brown round spots, which are common on the lower legs, especially around the shins. These spots usually disappear after 18 months, but they are a common occurrence in diabetic patients. Enjoying the video? Don't forget to like and comment below. 7. Finally, coming in at number 7 is skin bumps. The development of skin lumps is the 7th indication to be cautious. High blood cholesterol, which the liver finds difficult to metabolize, is a common symptom of diabetes and prediabetes. This can lead to the formation of hard, raised bumps under the skin that resemble clusters and range in size from 1 to 4 mm. It's important to remember that these bumps can also be a sign of thyroid problems, illness of the kidneys or liver. As previously mentioned, diabetes is primarily caused by insulin resistance, a condition in which your cells are not responsive enough to the sugar in your bloodstream. Therefore, in order to reverse diabetes or insulin resistance, the key is to optimize cellular function to effectively absorb excess sugar from your blood, ultimately regulating your blood sugar levels. To remedy insulin resistance and diabetes effectively, put an end to sugary snacks with high glycemic meals that quickly turn into sugar in your system. Starchy meals and goods like cookies made with refined flour chips, sugar-coated bread, pancakes, pasta, Coca-Cola, plus more processed sugars need to be eliminated. Reducing your intake of carbohydrates will increase insulin sensitivity, allowing your cells to attempt to rectify the blood sugar level. Incorporate good fats into your diet. Replace processed carbohydrates with avocados. To get healthy fats, eat pasture-raised eggs, butter from grass-fed cows, raw coconut oil, and extra virgin olive oil. When paired with proteins, these fats can help you feel fuller for longer, reduce hunger, and reverse insulin resistance. Include spices and herbs that lower blood sugar. To battle insulin resistance, think about including anti-diabetic herbs and spices in your diet. Good alternatives include black seed oil, fish oil, cinnamon, green tea, bitter melon, turmeric, berberine, and banaba leaf. These compounds have the ability to improve insulin sensitivity and control blood sugar levels. Consider embracing intermittent fasting by ingesting all of your daily calories within a 6-hour window. Breaking the habit of constantly snacking throughout the day is a major combatant to insulin resistance, allowing your body to recuperate for 18 hours. Fasting is a powerful method that can improve digestion, reduce insulin resistance, and open up your cells. Give good sleep a priority. Sleeping well and sufficiently is essential for controlling insulin resistance. Diabetes patients frequently have trouble getting a good night's sleep, which can raise cortisol and blood sugar levels. There you have it, 7 crucial skin signs that your body is experiencing a problem with blood sugar that needs to be rectified immediately. With these critical tips in mind, you can be equipped with the knowledge and education to further your health and wellness, as well as identify bodily symptoms as they are communicating to you. By enacting a swift change in diet, by limiting sugar intake, and adopting more healthy, nutritious choices, one can address insulin resistance head-on. Moreover, by adopting healthier lifestyle habits such as regular, consistent exercise, an anti-inflammatory, fibrous-filled diet, regular intake of nutritional supplements, a regular cycle of sleep-wake hours, stress management, and some medicinal herbs and spices, anyone can put an abrupt end to insulin resistance and balance the body's organ systems. Following these methods and more can put you on the right path towards longevity and wellness. Again, if you suspect these or any other symptom, don't hesitate to contact your healthcare provider for more information. Comment below with your feedback and hit that like and subscribe button. See you soon.